park and you go up. Squeeze a little bit. Squeeze really hard. Can you?
That's it.
Okay, don't do it anymore. Her jaw goes out and a little bit to the right. When she does that, it has a real nice, stable CO like this. Where's the other pain you always get, like a baseball bat hits you?
It's in the back of my head right here.
On that side. So when your jaw goes this way, you have a pain in the back when you squeeze. When your jaw goes that way, she feels like there's a baseball bat back here. And her teeth are still pointed, but then again, she has practically no incisal overlap. There is no anterior ramping. She just flies out there and clenches because she can. Some mornings or some nights, she's probably clenching like this. As goofy as that looks, what would happen if someone actually did that? They'd have this unfigure-outable posterior back of the neck baseball bat in the back of the head headache, which she's had for a long time. Mm-hmm. In your exam, you've asked about, do you ever have like a weird sinus problem? Mm-hmm. See, I haven't asked her that yet, but a protrusive clencher would have a weird sinus problem because the lateral pterygoid's got to pull the jaw forward in order to clench forward. And once it gets pulled forward, it just pulls backwards on the pterygoid plate. So you have a weird kind of a sinus condition?
Yeah.
Which is?
Oh, it's just this cheek hurts. The whole cheek will hurt. It'll hurt here, up here, here, inside the eyeball, like you want to gouge your finger in there. When my headaches start to get worse.
Is it simultaneous with your neck pain?
Oh yeah, it's like the whole package. It's like if I could just lop off the whole left side of my face, I could feel fine.
In order for her jaw to protrude and go to the right, the left lateral pterygoid is what's pulling it forward. So you would expect left facial symptoms, left posterior neck. And is your headache one-sided or not?
Yeah.
Which side?
Most of the time, left.
So it's just full-on squeeze fest on that one side. It's like this non-working excursive kind of a deal. So when you've asked those kind of things, you ever have unusual sinus conditions? Don't say sinus disease, just say unusual sinus, and they'll just start telling you stuff. You ever have like a stiff or sore neck? Oh, God, I have baseball bat, blah, blah, blah. And so then I'll say, make your jaw go like this. And they do. And I say, squeeze real hard, and they can. And it wouldn't be weird if they did that. And so now I know when I make my NTI device, I'm going to check for protrusive and make sure she can't get in front of the bump. Put your hand on the side of my head. This is what I do to my patients. Feel that? Mm-hmm. And so once they feel this muscle bulge in and out, then I bite this hard, stable object. And I say, I think that thing is killing you because you squeeze like nobody's business when you're asleep. Some nights you do it like off the map. And some nights you just sort of don't actually get there. And you wake up feeling not too bad. But it hurts right now to push on it. It's just waiting for something to irritate it. And so, sometimes I'll say, so there's these little threads in there that start to spasm based on the stress. It's always waiting. So I think if we can decrease the intensity of that activity every night, those threads won't be so irritable.